Hello everyone, good day, and welcome to our channel. Today we are going to understand yellow fever and its treatment options. Yellow fever is a viral disease that primarily affects populations in tropical and subtropical regions of Africa and South America. It is caused by the yellow fever virus, which belongs to the Flaviviridae family. The virus is primarily transmitted to humans through the bite of infected mosquitoes, with the Aedes aegypti species being the primary vector. Yellow fever is difficult to diagnose, especially during the early stages. A more severe case can be confused with malaria, leptospirosis, viral hepatitis, other hemorrhagic fevers, infection with other flaviviruses, such as dengue, and poisoning. However, observation of symptoms can help out. It typically manifests in two phases, named as acute phase and toxic phase. The acute phase begins 3 to 6 days after the initial infection and is characterized by flu-like symptoms, including fever, chills, headache, muscle aches, nausea, and vomiting. Many individuals recover after this initial phase. The second phase is toxic phase. For some patients, the disease progresses to a toxic phase within 24 hours of initially feeling better. Symptoms of the toxic phase include high fever, jaundice, abdominal pain, vomiting blood, and liver and kidney failure. This phase can be life-threatening and often leads to death if not treated promptly. As per World Health Organization, half of the patients who enter the toxic phase die within 7–10 days. If we talk about treatment options for this, unfortunately, there is no specific antiviral treatment for yellow fever. Supportive care is the mainstay of treatment, focusing on managing symptoms and preventing complications. Let's underline these supportive care measures one by one. Hospitalization. Patients with severe yellow fever require hospitalization for close monitoring and supportive care. Fluid replacement. Intravenous fluids may be administered to maintain hydration and electrolyte balance, especially for patients experiencing vomiting and dehydration. Symptomatic relief. Medications may be prescribed to alleviate fever, pain, and nausea. However, aspirin and nonsteroidal anti-inflammatory drugs, NSAIDs, should be avoided due to the risk of bleeding. Prevention of complications. Patients with severe yellow fever may require interventions to manage complications such as liver and kidney failure, bleeding disorders, and shock. Vaccination. Vaccination is the most effective way to prevent yellow fever. The yellow fever vaccine provides long-lasting immunity and is recommended for individuals living in or traveling to regions where the disease is endemic. Last is the use of some home and natural remedies that may help alleviate symptoms or support recovery alongside medical treatment. Here are a few. First of all, stay hydrated. Drinking plenty of fluids, such as water, herbal teas, or electrolyte solutions, helps prevent dehydration, which is essential during fever. Second, allow your body to rest and recover. Avoid strenuous activities that could worsen your condition. Thirdly, placing cool, damp washcloths on your forehead or taking a lukewarm bath can help reduce fever and discomfort. On fourth number is the nutritious diet. Eating a balanced diet rich in fruits, vegetables, and lean proteins can support your immune system and aid in recovery. Use of garlic and ginger is beneficial as both garlic and ginger have antimicrobial properties and may help boost the immune system. You can add them to your meals or brew them into teas. Last is the use of honey. It has antimicrobial properties and can soothe a sore throat. You can mix it with warm water or herbal tea. Remember, while these remedies may provide some relief from symptoms, they are not a substitute for medical treatment. If you suspect you have yellow fever, seek prompt medical attention for proper diagnosis and treatment. Additionally, make sure to take preventive measures to avoid mosquito bites, such as using insect repellent, wearing protective clothing, and staying in screened or air-conditioned areas. In the end, I am wishing you good health. Please consider subscribing the channel if you like this video.